It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with your own information on how to develop your own aging and care plans. Our topic today is HealthSouth Sea Pines Hospital. Joining me is Shannon Royer, who is the marketing coordinator for HealthSouth Sea Pines Rehabilitation Hospital. And I think you're going to enjoy the show today because we're going to talk about a rehabilitation hospital that is, I think you'll hear Shannon show you or convince you it's like a step above regular rehabilitation.
Well, no pressure.
Yeah. Well, I'm proud to say that because I think HealthSouth Sea Pines had made a major difference in me recovering from a major stroke, Shannon. So if you know, as you get into care business, if you know something good about a medical facility or a doctor or a procedure, I think you owe it to your audience, your viewers, your radio listeners, to do the very best you can to tell them about a service that is different.
Absolutely.
So, in your opinion, as the marketing coordinator for HealthSouth Sea Pines Rehabilitation Hospital, I got the whole thing right that time.
You did.
What do you, Shannon, think sets Sea Pines apart from other rehabilitation centers?
Well, honestly, there's a lot of different things that I could respond with. Specifically, HealthSouth Sea Pines, like you mentioned, is a rehabilitation hospital. So that in of itself makes us different than the other facilities in the area as far as rehab services go. We're the only acute rehabilitation hospital in Brevard County. And I'm sure we'll get into that a little bit later, but that definitely in of itself sets us up for a lot of different things that we can accommodate and better services that we can provide to individuals in need. And we also have it's a family dynamic there. We've had some people that have been working there since its inception 30 years ago. So it definitely, I think that you can attest that it really shows when...
Is Napoleon still there?
Yes, she is. Elba, yes, she is still there.
Folks, the reason I ask about Napoleon, my physical therapist there, her name is Elba. Mm-hmm. And Napoleon was, he was deported to the island of Elba after he was emperor in France. But the physical therapist's name is Elba. And in fact, she was, with me, a veritable Napoleon.
I would say she's a little bit of a general, so that would be...
Yes.
Yes, that's good, though.
But she made me do the exercises that helped me come back quicker.
Absolutely.
And that's what makes to me, Shannon, that's what makes rehabilitation in many forms different from others. Mm-hmm. You don't want to beat your patients to death.
No.
But you want them to do the things that will enable them to get back into mainstream.
Absolutely. And that's why we've jokingly said before, we're not a hotel, we're a hospital. And the implication there just basically means we're going to work you hard. You're not going to be sitting around just kind of relaxing. But the whole point of that is we don't want you to stick around. We want you to go home. We want you to get back to that life that you're used to and back to doing the things that you love and, that quality of life that you absolutely deserve.
Yeah, quality of life. Mm-hmm. That's the key word.
Yes.
You can go through rehabilitation and you might, as a result of your rehab, be able to do something fairly well. Mm-hmm. But why not try to do it to the best degree possible?
Yes, I would absolutely agree.
Yeah. And I recently had a very good friend, a large man, that I knew that had to have a hip replacement. Mm-hmm. He had a hip replacement, but then he developed an infection, and he was operated on. And I knew this guy would not be satisfied with some of the rehab places in Brevard County simply because I know the man. I play poker with him, and I know the guy. And he happens to be a graduate of the military academy, and I went to the Naval Academy, so we have sort of a disparity right there, jokingly. But I knew that Sea Pines would be a great place for him. He is in Sea Pines. He's there as we speak.
Very good.
But he's very pleased, very happy, and more importantly, his wife is very happy that Sea Pines has the guy, because you're able to do for him there what she could never have done at home if he came home.
Right. And I think that's something really that a lot of people don't think about when you're dealing with these traumatic events, whether it's a hip fracture or a stroke or brain injury. It's not like anybody ever plans for that to happen.
Right.
And the patient, I mean, as you can attest as being a stroke patient yourself, you have enough going on emotionally and physically that you're trying to handle. A lot of people don't think about the family members as well. So that's something that Sea Pines really does do very well at, is accommodating the family members as well, including them in the plan of care, keeping them abreast of the situation and realistic expectations as far as what they can expect for their loved one. Because like we said before, it's that quality of life, and we don't want to ever set unrealistic expectations, because people, of course, think, well, I was this way before, so I'm gonna be that way again. And there's certainly a disparity once the injury happens to what, is realistic afterwards with rehab. But we certainly do all that we can to get people back to as close to 100% as possible.
As a marketing coordinator, how much of your job is part of your job spent in patient observation? Do you also help track how a patient progresses through the different elements of care at the hospital?
Indirectly, I don't, as a marketing coordinator, since I'm not clinical, I don't really have a lot of hands-on with the patients. But I do, there's certain things that we do to kind of track progress that I can sort of communicate with for example, your primary care physician. I could communicate with him the outcomes, how well you did. We measure how well a patient is doing upon arrival at Sea Pines and then upon discharge as well. It's something called Functional Independent Measures, the FIM score.
Okay.
And it is literally a number that's assigned to you. Now, I can't get into the nitty-gritty of that because it's completely out of my expertise, but it does show a graphic representation of where someone is upon admission and then where they are upon discharge. And so from that standpoint, I do get involved because doctors want to know, as well as patient family members, how their patients are doing.
Okay, but you're part of, are you talking about the team approach here? Is that what when we talk about your part of the observation, do you participate in the weekly meetings that?
I don't, because I'm not clinical.
You're not clinical.
So from that standpoint, I don't really have anything to contribute, but I do communicate the importance of that team approach. That's what you're specifically referring to, is something that the HealthSouth model likes to call the interdisciplinary team approach.
Right.
And excuse me, that's pretty self-explanatory when I say interdisciplinary. It basically means all of the appropriate disciplines for your patient care. They're going to get together and they're going to go over exactly how you're progressing, what realistically they can expect for your recovery. They're going to communicate that with your family member and loved ones. If you're not doing as well as they had hoped, they're going to alter that. If you're doing better than they had anticipated, they're going to look at discharging you sooner. And specifically who makes up that team is, of course, our medical director or whatever physician would happen to be on your case.
Right.
Your case manager, your physical therapist, your occupational therapist. If you have a speech therapist, they'll be there as well. Respiratory therapy when appropriate, your nursing staff, and even dietary. They get all involved because there's so many minute aspects of what's going on with your care, and they want to make sure it's all very cohesive and very comprehensive. And they meet weekly to discuss that.
Okay. From having done shows with different levels of or different rehabilitation centers, I think as a marketing director, the ability for you to point out to potential clients this team approach is exceptionally important, because does this come about because Sea Pines is a hospital as well as a rehab center?
Well, specifically, we're a rehab hospital. So that does make a big difference as far as what we do versus the other rehabilitation facilities in the area. What you're referring to when you say other rehab centers, typically they're licensed as a skilled nursing facility.
Right.
You might hear people call that a SNF, or it's more familiarly known as a nursing home. And they do offer aspects of rehabilitation. And in some cases, it's more appropriate for an individual to go to that kind of a setting. But at the acute rehab level, we have the same regulations that Wusthof or Health First hospitals would have. And that does make a huge difference as far as what we offer care-wise.
Yeah. So some of the differences I've noticed, even before I met you, and when I had gone to Sea Pines to see other patients before I even was involved myself, I noticed a difference in the way the patients were treated. And I felt it was more direct observation, direct care. And when you mentioned skilled nursing care in a nursing facility, many of those also have rehabilitation sides to their whole modus operandi. But Sea Pines is a hospital, and your job is not to take care of long-term care patients.
Correct.
Your job is to recognize and bring very strong forces to bear on patient rehab from so many different acute things.
It's very well put. Are you looking for a job?
Well, I happen to think that, I know the value of getting the right kind of care after major surgery, after a major event of any time, particularly a stroke, fall, or in my case, when I had the dissection of the aorta, I didn't go to a rehab center. I went straight from the hospital to home care. But I was younger, and I was able to do what the in-home therapy folks wanted me to do. But let's talk a little bit about you mentioned respiratory, and most times when I think about Sea Pines or rehab, I think in terms of speech therapy, occupational therapy, and physical therapy. And am I right in saying that the speech therapy is probably the first thing that's looked at? And if so, why is speech therapy the first thing looked at? Why is that important?
Well, I mean, I can't say it's the first thing, because sometimes, for example, if a patient comes in with a hip fracture, they're not going to need speech pathology. But it is incredibly important. I can speak personally because my mother's actually a speech pathologist. So I, for 30 plus years have been exposed to that field. And there's kind of a common misconception with speech therapy. People just kind of assume that
This is what I want you to talk about.
Right. They're assuming that they hear speech therapy, they think of speech impediments and things of that nature, getting rid of accents or lisps or what have you. And it's so much more comprehensive. I mean, it's your communication, it's your ability to swallow. So from an independent standpoint, that means your ability to actually feed yourself and not be dependent on other individuals or a specific diet. So it's a very encompassing field that when you have an individual that has had a stroke, there's so many different areas of the brain that can be affected. So not only your speech and your ability to physically communicate with other individuals and, express how you're feeling or how you're doing, but your ability to feed yourself and to actually eat. I mean, there's so many complications that can go with not being able to swallow correctly. There's aspiration that can happen. You can get pneumonia. You can have all kinds of other complications from it. So it's hugely important.
Yeah. That speech therapy part of it is that you hit on a key. Most people think speech therapy is whether or not you can talk clearly.
Right.
But the aspect of the throat, being able to swallow, and if that's not recognized, I can't imagine where other things could get overlooked too.
Right.
So once we get by the speech therapy, a lot of people don't understand occupational therapy.
No, they don't.
I'd like for you to talk to our viewers a little bit about occupational therapy.
Sure. Well, occupational therapy, people assume it means occupation as in what they do for a living. So retraining people how to do their jobs. That certainly is a component of it, but the best way it's ever been described to me was occupation, meaning occupying your time. Any activity that you do that occupies your time. So whether that's brushing your teeth, putting on your pants, putting on your watch, just little everyday things that people don't think about, as far as the finite movements that would go into putting your watch on, putting your glasses on, brushing your hair, brushing your teeth, getting your meal ready in the kitchen, those sorts of things. That's all components of occupational therapy. Physical therapy is more the bigger picture, the bigger movements, and occupational therapy kind of deals with more of those finite things.
I think that one of the lessons that was driven home to me by your occupational therapist was the safety factor.
Mm-hmm, absolutely.
You might have an arrangement where, let's say, you're the stove. You're not really the stove, but you are going to be the stove right now.
Okay.
But on the top part is a microwave.
Mm-hmm.
And the sink is over here, and then the rest of the kitchen will go around here for our viewers. A lot of times you would want to just take what you microwaved out, turn around and walk over and put it on the counter.
Mm-hmm.
The occupational therapist says that's not safe.
Right.
You take it out of that oven, set it down, stand in front of it, and move it around on top of the counters.
Absolutely.
They teach you safety.
Yes.
And when you think in terms of balance and falls, the faster seniors, especially, realize that they have to they can control their environmental situation if they're smart about how they move.
Right.
If you move without having ready support, you're foolish. Mm-hmm. Canes are good, but canes don't always solve the problem. You have to have something solid to hand it on to.
Absolutely. And really, when you think about those aspects of safety, you're talking about independence in the long run, because the safer you are able to stay in your home by yourself, the longer term that you're going to actually be able to do that. And you're not going to have to rely on nursing assistants or assisted living facilities and things of that nature. And I mean, that's a whole show topic in of itself, just talking about the falls and everything else. But you're absolutely right. That is something that you as an individual can control more of, be it your actual body mechanics or little things like people don't think about throw rugs, because those are easy tripping hazards, or sometimes pets. I mean, I know I have a cat that likes to dart in between my legs, and that's a tripping hazard in and of itself. So yes, it's hugely important, especially with our seniors.
Does HealthSouth, I know that you have the in-facility capability. Mm-hmm. You have the, I want to say after hours, but you have people come in for, what do you call that?
Well, HealthSouth itself is an inpatient rehab hospital. So we do that inpatient, which means, of course, you come in, you stay in one of our rooms as a patient. We have the outpatient aspect of it as well, which is what you're probably thinking of. It's kind of the after the fact tune-up. You actually don't even have to be a patient at HealthSouth as an inpatient to qualify for that. You could have broken an arm or something like that and just need some basic rehab, and you could do our outpatient as well. And then in between those, it kind of bridges the two, is we do also offer home care services, which I know you're also very familiar with. Just home care in general.
Again. Say the last. What do you do in between?
Home care. So realistically, and it doesn't happen for every patient, but a lot of times, and I know this was similar to your situation, you would come to Sea Pines in the inpatient setting. You would be discharged to home with home care, and they would send you home with home care because you weren't quite independent yet.
Right.
And then once you've graduated from home care, then they would recommend outpatient. And outpatient, of course, for the immediate needs, but then long-term as well.
It's kind of ironic that you're talking about that, because when I went to Sea Pines the first time, it came about as a result of I had back surgery, and I developed an infection. And after having that treated, I just went through a lot of hate and discontent. And then I had home therapy from Gentiva. Yep. And they were very good. The very day, my last session with the home therapy was the day I suffered a stroke. So I ended up in Woodstock and then 15 days at HealthSouth. But I must say that I felt that of all the care situations I've been involved in myself, that the way that the Sea Pines staff addressed my particular situation, and I know I was no exception. They do this for all patients. Absolutely. All patients. And It's very individualized care. And I think the thing that impressed me the most, once Marianne, the speech therapist, decided that even though I'd had a hemorrhagic stroke on the right side, it really didn't affect my speech. But I know now it did affect it a little bit because I have a little weakness on the left side of my tongue. And if I'm not careful, I get my words twisted sometimes. So I have to watch that. But she decided that my hour of speech therapy would be better or be more productive if she added that hour into my physical therapy and put me into Bonaparte's class.
And that probably came also from when we were talking about that interdisciplinary team. That that came up, I'm sure, in that meeting. You know, she was probably discussing with Bonaparte and telling her she would know specifically how you were progressing in physical therapy. And so she basically said, well, listen, his time would be better spent here. And they discussed it and they came up with that decision as a group. And so they knew that you would be able to handle that. And so it was an absolutely appropriate thing for you, which is just so hugely important when you're talking about recovery from these acute events that people aren't anticipating.
Right. How many people can Sea Pines take care of at one time?
90. Realistically, we are licensed as a 90-bed hospital. Now, we don't currently really operate at that level just because we have certain rooms that are kind of private for more of our neurological disorders. But we could do 90 if we absolutely had to.
Okay. Are there any levels of clients that you would not accept?
Well, it gets kind of nuancy from that standpoint. We're at the mercy of CMS, which is the Center for Medicare and Medicaid Services. And they basically create the criteria for what is or isn't appropriate for an acute rehab setting. So what's going to happen is if there's something that happens to an individual and they're in the hospital, one of our nurse liaisons would go out and do an evaluation and see if they meet specific admission criteria. And the best way that I can kind of put that into perspective for the viewers is if you think about the regular hospital setting like Holmes or Woodstock. Okay. Let's say you go into the emergency room because you have a migraine. They're going to treat you for that migraine there. They'll give you pain medications or what have you. But you're not going to necessarily meet criteria to go up on the floor and get a room. It's something that you could just go home with. When you think about that in an acute rehab setting, it's not that hard to conceptualize that. They may or may not have an appropriate diagnosis for acute rehab. They might do just fine with home care, or they might do just fine in the skilled nursing facility because maybe they need a little bit more strengthening before they can come and tolerate that 3 hours of therapy that we offer. So that's why it really is kind of a finite situation where they have to go through and really look at an individual's diagnosis and needs. They're going to look at your medical history. They're going to look at everything. And that's what's going to make or break that decision.
Would it be sort of a logical thing to say that that assessment would determine whether a person would be more appropriate for nursing home care?
Absolutely.
Or for rehabilitation?
Absolutely. Because really the nursing homes that offer rehab, there is a place in the spectrum for them. They do have appropriate patients that really would just do better. They need that long-term aspect of things that an acute rehab setting doesn't offer. But like I mentioned, 3 hours of therapy a day, a patient has to be able to tolerate that in order to even qualify to come to our setting. And as you know yourself as an individual who had a stroke, you know what that all entails. Sometimes diagnoses just don't meet that. And it's also an individual thing. And a person just might not be motivated to do that. They might want to just kind of have a little bit more time to recuperate before they start doing their therapy. And again, that's why that setting would be more appropriate.
And having said that, I'll ask you, we only have a short period of time, but I got a loaded question.
Okay.
And it's this. In my opinion, Sea Pines has the expertise to do things that just might keep a person from going into the nursing home skilled care. And if they had a chance, borderline chance, to rehab, I think they stand a better chance. And I've seen it happen at your facility. Absolutely. And this is the hard call when you get into acute care and what can be done and what can't be done. This is where the approach to recovery becomes extremely important because I've watched the Sea Pines staff work on people that were it didn't appear that they were ever going to be able to elevate themselves with their arm. But I saw it happen.
Right. Absolutely.
It's perseverance, attention, and a desire to succeed. And that makes it different.
It really,
Can you
really
talk about
does.
that just for a few minutes?
I mean, it really does. I know our clinicians and our doctors would say that that's half the battle right there is your attitude and your desire to get better, because there's some people that really, they just aren't interested. They kind of give up, because you know that there's a huge emotional aspect that goes into these injuries as well. And sometimes people can't get past that. But if they really and truly are motivated and they persevere and they put themselves through that, then the same can be said of anything, working out or running or anything like that.
It can't. This is the degree of difference between staff attitude and professionalism, and then what comes into other places where staff rotates more often. The staff in the rotating places don't have the same degree of dedication, and you yourself said it, when you have people that are 28, 30 years.
Well, absolutely.
Makes a difference.
Absolutely. Anytime you have that support, that outside support that's helping drive you, then that's absolutely going to help you achieve that.
So, folks, if you got a question about somebody coming out of a hospital or in rehab, call Shannon down at C-Pines. And at least, Shannon, I think people owe it to themselves to get an assessment.
Yes, they do. It doesn't cost anything for an evaluation to be done when you're in a hospital setting. So they can always ask for a acute rehab evaluation by C-Pines.
Okay. Successfully, we have about 1 second left to go. So I want to thank you for doing this show.
Thanks for having me.
I hope you, our viewers, have gained something from what Shannon and I have discussed. And I want to thank you for watching today's episode of Helping Seniors. This is Joe Steckler. I am broadcasting from radio station WMEL 1300 AM, where you can hear our Helping Seniors program on the radio every Thursday at 1 p.m. The work we do at Helping Seniors is important, but we can't do it alone. That is why our media sponsors, such as AM 1300 WMEL here in Brevard County, are so important. I'd also like to thank other media partners at Senior Scene magazine, where you'll see our Helping Seniors newsletter as a center pullout feature in each month's edition. You'll also see an article each month in Hometown News, a weekly local paper. And I'd also like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors, that help us carry the cost of both our outbound information programs such as this, as well as our inbound information efforts by calling our senior information line at 321-473-7770. There, they will get help and direction that could be helpful for their specific situation or circumstances through information, education, and access to resources. Lastly, I'd like to thank all viewers, listeners, and readers who take an action step and help as individuals to support the mission of helping seniors. It's quite easy, actually, to join them. You can call us at 321-473-7770 to get involved as a partner with Helping Seniors, or you can also donate directly on our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.